Hello everyone, and welcome to this Bostix broadcast. This is a Bostix broadcast in around a newscast edition, a Bostix bulletin, a part of the Communique Tsunami. This is a chartered edition and an evidence-based with an evidence-based perspective. And in this Bostix, as part of this Bostix broadcast, as part of this Bostix broadcast, which and aligned to this newscast edition, is another Storm of Bostix production, and wherein there'll be an overview in regards to collaborative works that had been carried out in in around 2020 in around 2021, and where this works looks at sort of integrating healthcare education for CKD patients, chronic kidney disease patients, and looking at works works aligned to what is deemed clinically relevant context, and where this works has a sort of a qualitative basis in context of collaborative research that had been carried out. Collaborators at the same time were between two academic institutions in the United Kingdom, and also where collaborators were collaborators in on this work were also from between two social media platforms, and where collaborators were were also where collaborators were also involved various international involved from various international perspectives in aligned to this works. So also where this works originally was presented as a research poster at the American Society of Nephrology in 2021. So the aims around this works were in around where the changes to patient care will are generally sort of set the change in context of the nature of roles for allied healthcare professionals, or AHPs, across chronic kidney disease, or CKD. And online spaces also prompt sort of a change in between areas of kidney care practice and healthcare professional involvement between healthcare sectors. The aims of the objectives of this United Kingdom led investigation include the following. Number one, to understand which topics and subjects are pertinent to CKD patients. Two to understand whether retrospectively that if there has been an educational neglect as part of healthcare delivery. And three, to understand how healthcare and education for CKD patients could be more integrated. So in around the background of this works, CKD is regarded or has been evidenced as in literature as a public health problem, sort of globally. And the long-term condition, or LTC, affects 10 to 16% of the general adult population, in fast and developing in fast and slow developing countries. And 5% of the UK population suffer from CKD stages 3 to 5. The characterization of CKD at all stages is an important part of its management and allows the initiation of appropriate treatments with the aim of slowing progression of kidney disease, slowing progression of kidney disease. CKD in children or in pediatrics or young people, children and adults, is characterized by kidney damage or decrease in glomerular filtration rate or GFR or of less than 60 ml per min for 3 months or more, recommended as recommended and as recommended by guidelines referred to as the Kidney Disease and Quality Outcomes Initiative, or KDOQI, sort of retrospectively. Um, Although at the same time, guidelines aligned to from for example from the UK Kidney Association and UK renal registry data inform some updates in around the epidemiology and etiologies across CKD CK diseases and related and in regarding. And there has been growing intrigue in around a sort of qualitative research, in context of healthcare, often where in context of health or healthcare, which has also been a sort of associated where researchers and investigators seek to understand sort of the concerns and issues around around CKD and related diseases. However, the emphasis of evidence-based medicine, or EBM, accompanied by recognition of importance of quality of life, has prompted healthcare professionals of varying disciplines or specialties to acknowledge the basis in around utilizing sort of qualitative methodologies as well. The findings of qualitative research can complement quantitative investigations, offering insights and explanations relating or regarding to individual or cohort experiences, attitudes, and beliefs in order to inform and develop better strategies. In a U.S. pilot investigation focusing on pre-dialysis education, several modalities of interplay and dissemination for education had been evaluated. This had included face-to-face education and online sessions, and where the endpoint was one of the main endpoints in a particular investigation was a patient's ability to select form of renal replacement therapy or kidney replacement therapy or modality right for them. And 3 assessment tools were utilized to compare cohorts or groups, including CKD knowledge, literacy, and quality of life. Education is required to support CKD patients have a smarter understanding of disease and treatment and aligned to treatment options. Patients in works that have been published. Patients in works that have been published. Patients had informed that they had wished that they had been had the educational basis in around particular in around aspects of treatment modalities, earlier, irrespective of face-to-face or online, approach. Providing up-to-date, accurate, and healthcare information is thus pinnacle for patients to take lead in aspects of aspects in around around healthcare. Um, Briefly, in around CKD definitions and classifications. So some investigators describe acute renal failure as acute kidney injury, and acute and or chronic renal failure, um, uh, sort of in some works synonymously. And these terminologies have been used interchangeably in investigations that focus purely on acute renal failure, where patients have abnormal estimated glomerular filtration rate. Um, studies have recalled on patients with reduced baseline kidney function, normally less than an estimated glomerular filtration rate of 45 ml per min, and some of the many cases that required hemodialysis as a form of renal replacement therapy, or modality had been referred to as acute, and wherein acute would fall into CKD stages between 3 and 5, and were associated with higher rates of morbidity and mortality. However, end-stage renal disease, or CKD, or and or CKD, stage 5 is at the severe end of the disease spectrum, where patients require a form of kidney replacement, KRT or RRT, until a renal transplant, kidney transplantation becomes available. And the issue here, at the same time, in around CKD definitions and classifications, is that terminology can become confusing, and there is a sort of an overlap, in around CKD and CKD, chronic kidney disease, CKD and CKD stages. And so there needs to be literature has informed there needs to be more done to address the issue and provide transparency between CKD stages. Now, in around this collaborative works, there was a basis in around patient and public involvement, and in around patient and public involvement, or PPI, and a basis sort of where in around some aspects in around where the data collection was involved, some aspects in around the ethics and materials and methods or methodologies. So topic tags were sort of co-developed between two social media platforms, the RPSG, the Renal Patient Support Group team, the RPSG team, and the Kidney Disease and Renal Support Group for Kids, or KDARS for Kids team, for this investigation, where topics between the two social media platforms were co-developed, having understood the remit of the organizations. And prior to the topic tags being co-developed, an extensive investigation or an intensive investigation for at least 1 month between March and April 2020 collated the most popular terminologies utilized by service users and those between the two social media platforms. This resulted in 14 different topics being co-developed more formally. Topics were tagged for 2 weeks per social media platform. So through the RPSG, the Renal Patient Support Group, representing the online adult sort of renal population for 2 weeks, and then 2 weeks through KDARS, the Kidney Disease and Renal Support Group, KDARS for Kids, representing online pediatric or young people sort of renal population. Topic tagging retrospectively sought to aided the understanding for healthcare areas that are popular and where patients or service users between the two social media platforms would gain a sort of further advantage from education involvement, and topic tagging. At the same time, the basis in around the topic tagging activity that was initiated through this works, had been evidenced in works by several authors, and researchers sort of retrospectively, sort of retrospectively and sort of more recently. So in 2005, 2007, and in 2021 as well. Conducting a 16-year retrospective descriptive analysis in context of some of the quantitative research, quantitative works that took place through this, and there is another a Bostix broadcast as well, listeners. Another Bostix broadcast that sort of looks and delves into more of the quantitative research perspective around this works, but so far but say but however, just sort of a little bit in around this in as part of this Bostix broadcast as well. So conducting a 16-year retrospective descriptive analysis of topics and tags between the two social media platforms sought to understand where there are healthcare educational inefficiency and identify what educational needs still need to be met in the care for both pediatrics and adults with CKD. In addition, quantitative data collection excuse me, was implemented to understand online patient educational requirements. At the same time, the team, the collaboration, the collaboration involved the implementation of a survey or poll, a survey or a poll that had been put into put onto put on between put on had been made available for participants through the RPSG and KNRs to complete, and where this was a sort of where there was a URL or a link through software called Qualtrics, which was made available for up to between 6 to 8 months through both platforms, social media platforms, and participants only had to complete the survey, the appropriate survey or poll once. And descriptive analysis was used to analyze data, and the data collection followed on from research that had been published, had published similar works in 2020 by one of the collaborators in this works, in similar works from in 2020 by one of the collaborators in this works. And the research sort of in around the ethics aspects around this works. The research had an ID, an ethics ID aligned to where the works was approved by an ethics committee in the northwest region of the United Kingdom. And PPI, in around the PPI aspect, the PPI had been an important mechanism in and involving patients or service users, added focus and sort of rigor to this works. In the collaborative works, or at least in the poster, in the research work that had been presented, there is a table there's an overview and a summary of the main topics co-developed and tagged through the RPSG, uh, and um, and um, and a summary of the main topics co-developed and tagged through the kidney disease renal support group, or KDARS, for kids of the pediatric young people's sort of equivalent in context of the of CKD, or kidney disease. In around the in around however the sort of results the results the analysis and results, um, five main themes were identified through this investigation, including, number one, using different mediums to collect qualitative data and understanding healthcare; two, reliability and validity of using the internet to collect data; number three, healthcare, patient and public involvement and maintaining confidentiality through online methods to collect qualitative data; advantages and disadvantages and limitations to online data collection and peer support groups; and five, using qualitative methodology to understand educational requirements for CKD patients. In addition, the investigation informs that social media platforms between adult and pediatric young people cohorts discussions are not just clinically relevant, but also pinnacle understanding of where the gaps in education have been for close to or near 2 decades. The RPSG has had the RPSG when this works was conducted, had in around just under 9,000 service users or members, under just under 9,000 members, in from sort of patients or service users from the adult online population in context of CKD. KDARS, as the in context of pediatrics and young people, had has near had just over 1,700 pediatrics or young people and parents and guardians in the KDARS social media platform. And between the two international groups, between the two international social media platforms, and during the month the 1 month where topics were tagged, 2,560 threads, 2,560 threads were tagged against 14 different topics. The results inform that patients between both adult and pediatric cohorts still require additional support across several areas of kidney care. And this retrospective trend analysis provides a snapshot on qualitative data of topics and context in relating to evidence based from the two social media platforms. Again, in around close to 2 decades, specifically 16 years. The topics that were tagged, or sorry, the topics that were co-developed and where threads or discussions between the two social media platforms were tagged include, for example, lab tests and biomarkers, biopsy and surgery, nutrition, renal replacement therapy or kidney replacement therapy, psychology and related, medication and pharmacy, lifestyle, primary care, wellness and well-being, nursing, physical activity, peer support, COVID-19 and infections, and electronic patient records. So the same topic tags, the same topics were co-developed, aligned to both cohorts, the original research that had been presented has has the data has qualitative data in context of the topics tagged and the themes, and where, for example, where excerpts had been sort of adapted from particular years when for example, sort of looking at data, looking at qualitative data against a particular theme, and where data was retrospectively identified in context in context of a year when patient or service user had posted, and then where the research highlights the context, the specific context against the topic tagged and theme, and also where aligned to the topic tagged and the theme, and the year that context was posted in, again aligned to topics tagged and themes. There is also context relating to citation and evidence, and the evidence base, where from the literature there is some works that have identified research in around a particular context, in around particular context. So, for example, in around lab tests and biomarkers. There's in the original sort of research works, there's the patient context, and then a paper in around this, in around the lab test and biomarkers. There was a paper that had been published, for example, in around 2018, in a particular journal, and where in aligned to the patient context is where where the collaborators through this works sought to link that patient context to the literature, where literature identifies specific bases in around what the patient had been discussing, and also in a context of the in context aligned to the ethics and as well, which which was also important as part of this works, was there was no identifiable information against those who, for example, posted in around a particular topic, a topic tag and a theme, and all data that had originally been presented by collaborators, or put together by collaborators in this works, was confidential. Was where there's any patient identifiable information was confidential, and it was and all data was anonymous in context of qualitative data collection, and in around the sort of conclusions around this works. So retrospectively, methodologies for data collection have become sort of more diverse, and the way patients are encouraged to get involved in research has become of more intrigue by both service providers and in between healthcare sectors, and to facilitate sort of the interplay, the patient and public involvement aspect should be accompanied by strategies to support patients interpret and ascertain education provision around disease trajectory, for example, and this would sort of strengthen the patient professional patient and patient and professional or service user, service provider efforts, and patients between the two social media platforms have had again have where the research had highlighted that the service users between or the patients between the two social media platforms have educational requirements, and thus access to healthcare professionals online or otherwise would be important to support best practices prospectively. AHP groups or allied health professional groups allied health professional groups may increasingly find themselves taking on responsibilities, particularly where involvement is increasing, dependent on bridging educational gaps and alleviating misinformation through online spaces. And kidney care and nomenclature is and has been continuously advancing, and thus it must be appreciated that service users or patients should be armed with the appropriate context and information so that they are able to have those important important interactions and communications and discussions with health professionals or service providers. To this end, it is now to this end the research has highlighted that patients should have access to different professionals, health professionals, to help bridge educational bridge areas in around educational advice and support. There's works that had originally highlighted where, for example, where one team in 2017 highlighted that had highlighted or informed that patients are not, or patients or service providers are not, sorry, so where investigators in 2017 had highlighted in works that in research that through online spaces through online spaces, service users and service providers, there was little evidence or no evidence to indicate that any by any way of information, any context that is shared through online spaces between service users and service providers, service users, is not deemed as clinically relevant context. At the same time, the topic tagging for 1 month per social media platform could sorry, a topic tagging for 1 month per social media platform in this works, or more sort of prospectively, or more could offer opportunity to identify more experiences between adult and pediatric online spaces, adult and pediatric or young people like or young through or young where young people through particular support groups or social media platforms where social media platforms are governed, and to thus identify and gain a more in-depth analysis around uh, around around important important discussions that take place to support patients and to support service users between the two social media platforms. For examples, and patients and families will also require educational support surrounding CKD guidance, guidances and frameworks around the disease and disease processes, etiologies, and severity, etc., are important. And access to allied health professionals online can provide patients, service users, with educational support and evidence-based practices. Co-developing educational modules, for example, involving service users and service providers would prompt quality of joined up care in meeting information needs and addressing potential healthcare disparities. Online educational support can offer collaborations as well between service users and service providers. So this works is available through the RPSG platform, and in the descriptive with this Bostix broadcast, there will be some resources that listeners can check out as well, where the resources are linked to the research that had been carried out, but also where similar research has been evidenced in around the aspects that have been pertinent in this works. And that draws this Bostix broadcast to a close. This is a Bostix broadcast as part of a newscast edition. This is a Bostix bulletin as part of the Communique Tsunami, and this is a newscast edition as part of a chartered edition, an evidence-based perspective, and another Storm Bostix production. Thank you for tuning in.